for joining us, and she's going to talk to us about the progress report on the vaccination programme in Worcestershire. Thank you very much.
Thank you very much, Jo, and hello everyone. And it's my last, one of my last days with you. So it's also hello and goodbye. So it's been really nice working with you over the last 6 years I've been in the system. So, but today I'm just going to talk to you about the progress on the vaccination programme, just to give you a bit of context if some colleagues aren't aware of it. Across, and I'm talking about Herefordshire and Worcestershire, and I'll try and narrow into Worcestershire for yourselves, but across Herefordshire and Worcestershire, we have 24 sites that will go live completely hopefully by the beginning of February. Now in Worcestershire, we have 13 primary care network sites. So every area of Worcestershire is categorised into primary care network, which is a group of GP practices that work together, and each one of those has one site that they deliver vaccinations for the population of those practices. We're also opening the Artrix site on Monday, or next week. We think it's Monday.
Getting towards the end.
So I'm getting a bit of feedback there. On Monday, and we're waiting for national sign-off that we can have the St Peter's Church in Worcester opened, and Malvern, Three Counties Showground in Malvern opened, and we're expecting that to happen in the first week of February, and maybe the second week for Malvern. There's just a few glitches we're having to work through. So that's our plan. So by the middle of February, we'll have all our capacity open and ready to go. So that's quite a significant amount of capacity. 13 sites of primary care networks and 4 community vaccination sites. Sorry, 3 community vaccination sites. And there's also a site at the Alex Hospital, which is specifically for healthcare workers and social care workers. So that's how we're operating at the moment. Now, across Herefordshire and Worcestershire, we are doing 30,000 vaccines this week, and we're doing another 30,000 next week as well. Our sort of holding back element at the moment, the things that's sort of keeping us from doing more at the moment, is availability and access to vaccines. So as nationally, what they're doing is that they're looking at the systems that aren't necessarily progressing as well as others, and the vaccines are being moved towards them to make sure the whole country comes up to a good level, rather than keep sending the same amount to the same system. So they're just trying to balance it out at the moment, which is good news and bad news for us. The good news is we are doing extremely well across the Midlands region. So I mean from Herefordshire all the way over to Norfolk. We are the best system for uptake for those over 80s and those in our care homes. So we, as a proportion of our head of population, we have vaccinated the highest proportion in those 2 categories, which is our first 2 cohorts of the Joint Committee of Vaccination Immunisation cohorts, JCVI. So that's really good news. So I'm really pleased to report that to you. And as of the 19th, which I think was Tuesday, each day merges into one in lockdown, doesn't it? Was Tuesday, we had done over 10% of our population, just over 10% of our population across 2 counties. And that's compared to a national position of an average of 6% of our population. So we are doing really well, and we're moving quite significantly through our healthcare workers and social care workers. We have widened it out from the NHS. Social care frontline have had access at the same time as the NHS frontline staff. We are including dom care, clearly care home staff, and we have also invited pharmacists, dentists and optoms as well. So we're widening it and quite out. And it does feel that we are sort of now reaching the people who were a bit reluctant in the first place to go for it. So we're sort of having to do a bit more sort of encouragement and improving access and sending out quite a number of sort of repeated emails to ask people to book in. So we are finding we're getting potentially to the last 30%, 20% people, which for different reasons why they haven't had vaccines, they may well have been unwell. But we are finding that the reluctant ones are coming forward, and we're having to give a bit more support to them. But we are very confident if the vaccines continue to come out at the level we expect, we will have delivered by the February 13th target, which is to get all JCVI cohort for the 4 cohorts vaccinated by the 13th of February. If we get the vaccines that we want and that we can deliver, we should be able to deliver that by the early February. It just depends on our vaccine availability. So we have the capacity. Workforce is always an issue, but we are managing to do the workforce, and people are volunteering, and we've got volunteers and we've got people redeployed as well. So we're managing to do that. We have to make that more sustainable as we go forward for each of those, but we're working on doing that as well, about redeployment from all our organisations to support the programme. But we're in a really good place considered compared to other colleagues and other systems. We're delivering well, and we can actually do more if we have the vaccines. So having the vaccines is having more vaccines is our sort of a blocker at the moment, but I'm happy to report and hope you agree that we're in a really good position in what we've delivered to date. I'm happy to take any questions from there, but I just thought I'd give you a summary of our position.
Thank you very much, Jo. Does anybody have any questions? I think I've got 2 legacy hands up from Alan and Martin. Jonathan.
Jo, thank you for the update and information for the wider board. The people and volunteers actually who are working with people who are experiencing homelessness, so staff at St Paul's and MAGs, and indeed extended to the Worcester Street Kitchens, are all now in priority 2. And indeed, I can report all my staff would have had vaccination 1 by the end of this week, which is fantastic news, and thank you. The question then arises, there's been some press reports of a GP in Oldham who brought homeless people and gave them the vaccine ahead of perhaps what the national priorities were. My understanding is that's not the intention here in Worcestershire, to change or deviate from those JCVI priorities. Is that correct?
That is correct. Now I can't 100% guarantee that no one's got through the net or through the gate. We do know that some people have, and especially at the beginning, we did have some issues with some staff sending emails to their family and stuff, and we've had to pick that up every time we've seen them. But a very strong position is if you're not within the JCVI cohort, the vaccine's not for you. We have to protect this vaccine for that cohort, and wait your turn really is our message on that.
Thank you. John, did I see that your hand was up? John Taylor?
Yes, please. Hi, Jo. Just want to check whether you know anything around the BAME groups, whether there's anecdotally we're picking up that there may be some difficulties getting some groups to take up the vaccine. Is there any information about that locally?
So we haven't collected the information on it yet, but we have got a public health and NHS working group, and actually once we get the data coming through, we are making sure we focus and that they are overrepresented in our samples. So there is work on that, John, to make sure we're attending to it, but we haven't got the data through yet to say if we're succeeding at that or not. But it is definitely there's a group whose job is to monitor that for us and make sure we address it.
Okay.
And focus on it.
Thank you.
Okay, thanks, Jo. Bernie, I think you've got a question.
Yes, thanks. I can't find that hand up button on my thing. Yeah, further to Jonathan's point. So, hi Jo. I saw it on the news. I can't remember if it was Marv or something like that, about when you've got a vial that has got sort of 1 injection worth left, 1 vaccine worth left in it, and if everybody on that list has already been sort of vaccinated, then people are being encouraged to call in the next sort of phasing group. Is that happening here, or is that something that's not been rolled out yet? What I mean, just to ensure that every last vaccine is being used, and that there's I know you said that we're short on vaccines essentially and you're just waiting for that, but just to make sure that nothing is getting missed and that other cohorts can be brought in at the last minute, if that sort of thing that's being rolled out.
So what we've created, and it's called something framework. For the life of me, I can't remember what the framework's called. It basically means if you get to the end of the day and you need people to come in quick, we have a list of the people that we can phone, and we make sure that each PCN has that and the providers. So there is a process that people are going through to make sure, and they are probably phoning those who meet the cohort but live a bit closer, so they've got their phone call round about that. On Monday we received a letter from the national team which allows us to go beneath 80-year-olds now, and we're starting to see that 70 to 75-year-olds are starting to be invited in, and we're seeing the data showing that's increasing, and we are seeing that people are keeping to that, and the 70 to 75-year-olds, because we are able to do that, are less. There's less of those, but more of the over 75. Does that make sense? So people are making sure they stay in the cohort, and they are starting to see those people under 80 between 75 and 80 for sure, and the smaller number between 70 and 75. Wastage is a cardinal sin, but equally we don't waste a vaccine just for the sake of not giving it to someone, but we really are trying to make sure, and our second dose numbers are really, really low. It's a clear line. We do not give second doses, and we've had to monitor that quite closely last week, but this week we're in units if it's happened, and I expect it's because literally it was going to be wasted if they didn't do it. But the second doses are definitely no, but we have got a framework to support and practices and the sites to be able to deliver against, to give the vaccine to the right people.
Thanks very much. Lee, I'm conscious that you asked a question earlier on about being a key working organisation that was open. Do you want to re-ask Jo that?
Yes, I was just putting forward that there are some voluntary sector organisations that are classed as key workers doing essential work throughout this pandemic, like ourselves, Sandra Croft in Redditch. Where do we sort of fit in with regards to obviously being frontline workers to have vaccine, because we're not necessarily NHS. We have NHS contracts, but we're not NHS workers. But actually we are a cohort of people that are still actually doing face-to-face work with the most vulnerable clients that obviously need to be seen through this period. Do we factor in anywhere?
So I'm sorry, I'm not the expert on your specific group, but what we are doing is that the local authorities, both of them in conjunction with us, have given us a list of all the organisations that are considered in the cohort, and there's a definition, and apologies, I can't recall what the whole definition is. But what I can say, if the local authorities decided on you and consider it, then you're in the list. I really apologise, Lee, that I can't be more specific. But I think as time goes on, that list will get wider. Police, for example, fire, teachers, they're all not in that list, and we're getting quite a lot of pressure, and quite rightly they feel the same as yourselves, but we're having to stick quite tightly to that cohort at the moment. But my view is that as we seem to be quite a long way through our healthcare worker, social care worker frontline and staff, which I'm also shocked that we're in about 70–80%, which I just can't believe really. So we're just sort of going back to double check, rethink that. But as we get to that point, we can then start saying, okay, we're now ready to be able to receive other people. So so apologies, I can't be more exact on that, Lee, but I think it'll become more available, especially as we move to more vaccines in coming through. So 30,000 this time. I think 3 weeks ago we were around 18,000 a week. So it's gradually getting up, and we're gradually getting more ability to be a bit more flexible on that. But it is quite tightly managed and overseen regionally, which reports up nationally about who we are doing and who we aren't. I don't know if that really answered your question, but I appreciate that you're important to us and it is an important group.
Yeah. Thanks very much. Are you mainly, is it mainly the AstraZeneca Oxford vaccine now that is being delivered?
We still have Pfizer, and they mainly go to the hospital hub sites, and in the primary care networks there's a mixture. So there's some Oxford out there, but it's a mixture at the moment of both.
Is there a preference on the vaccine? Are people asking for one above another, or is there any sort of, are there any disgruntled customers, so to speak, like, oh, well, I wanted the other one? Is there anything like that happening that you're aware of, or is it not important at this stage?
Well, to me, it's not important, but people seem to be having a preference over one over the other. And all I'm going to say, just take the one you're given and be thankful. Is my message.
Thanks. And I think Pete Sugg had a question.
Yes, there's two things for me. One is a follow on in terms of we've been in terms of key workers who aren't in NHS or in the council. We've got a contact called Selina Nicole Taylor, who basically we've contacted in terms of youth workers and our Seek and Reach project through Young Solutions. And they're, as you just said, Jo, they're on a list, and our workers will be contacted for that. So that was the first thing. Selina has been really cooperative in terms of understanding about this group of staff who perhaps initially were sort of hidden, particularly in the voluntary sector. But I think the trust is really is on top of that now. Then the other thing for me, from a personal point of view, is about my usual pet subject of people who are receiving direct payments outside of the system, as it were, and don't appear to be on any lists. So actually, when I spoke to Selena about it from a personal perspective, she also said there's been a number of issues where people who are getting direct payments rather than doing stuff via the local authorities, there has been a bit of an issue. But she said again, those people are going to be sort of picked up on. But I think that may still well be, particularly the clinically vulnerable who aren't on a sort of local authority list.
Yeah, I agree, Pete. It's that group we're starting to pay attention to, because some of them they're employed by the client, aren't they? So no one might know about them. So we've now got the bandwidth, I think, to start thinking about how we pick those people up. So it's something I'm looking at the moment. So
because it was slightly worrying that via the CCG that was a note came through before Christmas about flu jabs. I think it was October, November. Flu jabs being available for the staff, but they couldn't source them. So again, the issue about they'd identified that these staff who were working directly for people who were employing them directly qualified, but there wasn't any way of getting them a flu jab.
Yeah, so, we had there was a big campaign, wasn't there? And the flu jabs didn't arrive till late November. And partly it's a good news story. It's because the demand for vaccination was considerably higher than all the vaccines we had, which were ordered in January and February, were all gone. Probably by October, and so they had to wait for the increase to come through, which did eventually come through, but it was much later than people.
Yeah. I think it's a point Simon and I are raising all the time is that authorities are desperate for people to be direct payments, but it actually, especially I think from the staff perspective, it's like us and them situation, because they only get the support that their contracted person can kind of sort out for them. Now it's not so bad with us because we're fighting on behalf of our son, but for most people, they wouldn't have either the contacts or the inclination to be able to sort it out. Whereas if they work for an authority or a care company or whatever, it would just happen. So I think this is something we probably need to keep an eye on from a Health Watch perspective, that these guys don't miss out.
Yeah, I agree.
Yeah, thanks, Pete. Simon, have you got, because I thought you might have something to follow up with that.
Yeah, I was just going to follow up on that. I mean, there seems to be, for people who employ carers via a personal health budget or a direct payment, a gap. It started off with COVID-19 testing of their carers that they employ, and there has been no provision made for that. And now we're hearing about the vaccine problem. We raised it with Health Watch England, Joe. We've taken it up with the Department of Health and Social Care, who seem to think they've addressed it, but now recognise it might not have been addressed.
I think locally we just need to work with the creative ways of finding these people, the ones that don't, which need a bit more help to access and get engaged with. So.
Well, as far as the COVID-19 testing was concerned, we were going to, now we've had a response from Health Watch England via the, which is the response from the Department of Health and Social Care. We were going to forward that to the Director of Public Health and ask her to forward it to people with direct payments or personal health budgets, but we perhaps need to build the vaccination issue into that as well.
I think that'd be brilliant, Simon, because I think the vaccination thing, particularly for the staff, is very worrying, because basically they can't, it's really because of the vulnerability of their clients, they can't really work. So I think
I know, Peter. We spoke to one guy who since March has stood down about 10 staff, and between them and they've been doing care 24/7.
Yeah, exactly. Same.
As Joe would appreciate, at the end of their tether, really, in that situation, and they're in danger of falling over, and then the child, the patient ends up going into care.
Yeah. But I think, and the staff all get the vaccine. But I think what I have to say, this Selena has been brilliant in terms of being aware of the issue and actually trying to do something about it. But it'd be interesting to see how quickly it happened.
Okay. I'll feedback your thanks to her. But
thanks very much. Thank
you, Mike. Do you have a question?
Yeah, just a quick question. There's been lots of comments in the media at times about delays at testing centres because people have to have their NHS numbers. Is this a myth?
Do you mean vaccination centres?
Sorry, vaccination centre. Yeah, sorry.
Yeah, no, it's, well, I don't know. Well, you do have to have your NHS number, yes. So there probably is a delay. So it's probably not a myth, because it will delay it because you have to think of another way of doing it. But your NHS number is really, really important. So they try and find it, and it's easier in the PCM because they can look up your thing. But
Yeah,
it's on the sites that aren't necessarily directly linked. But I'm now going into the digital world, which always goes above my head. But I don't think it is a myth, but it is something people need to be aware of. Take your NHS number. It is much quicker if you do.
Do we
because I
need
know a
to
lot of
spread,
people who've
spread
had
that
their
about?
vax, and they all said how wonderful the system is. It all works incredibly smoothly.
Yeah, and good.
Thank you.
Are the public aware of the importance of this? So when they're booking their appointments or being told that they've got a vaccination booked, are they being told you must bring it rather than waiting until they arrive?
From where we sit, we think it's quite clear, but it doesn't always mean people receive it that way, is it? It is on any letter that comes out. It is on the booking system as well. Actually, we need it for the booking system as well when we get to that point, the national booking system, which we're not quite at yet in Herefordshire. So at some point people will see it at home and know they need it, but it is, if you can get any message out, please find out your NHS number, and because it will make it a lot easier.
I wonder if I could just ask a question about those patients who refuse to have a vaccination. Are there any plans to go back to them and ask them if they would like to change their mind, particularly after they see that a lot more people are accepting the vaccinations, so they might want to change their mind?
So in care homes, residents, we're aiming for 99%, so an uptake. We always wondered if that would be the case, and I think at the moment we're about 85% in care home residents. Which is quite a big, so it's never a no, it's never, you can't, once, one shot and you don't get it. It's actually, if people do, but and sometimes they don't have it because they were ill or they've had it recently, and there's a few clinical reasons why you wouldn't give it to someone. So we're doing quite well on the care home uptake. Care home staff, I think the last one I saw about care home staff, which is 47%. Now, care home staff, historically, if we compare it to flu, don't take up the flu vaccination as much as we'd like them to either, and that's partly because of the age group, and they don't necessarily see it's required, and the vaccination doesn't say at the moment it will stop you conveying it, so they do question if they should have it or not. So there might be an element of them waiting to see how the rest of us fare with it all, but it's never a no. So if you the appointments are there, you make the appointment. The worst thing you can do is make the appointment and not turn up. So so we're finding at the moment the appointments are being taken, but in healthcare and social workers, we are starting to see that, as I said earlier, the reluctant sort of, I'm not quite sure, but I've turned up because I think it's the right thing. So I think we are shifting and seeing people who might have said no before and didn't turn up at the beginning are coming through now, maybe because they're seeing it's okay, and appreciate it's a good thing for them doing that in those groups.
Good to hear, thank you.
Lee.
We've noticed the sort of reluctance within the BME community, predominantly the Asian community in Redditch. I don't know if that's a county-wide response, but I know there's a lot more conspiracy theories, a lot more things about the vaccine and the actual pandemic itself. Yeah. One of the areas that we're looking at the moment is trying to encourage younger members of the family, the BME community, to encourage older residents to undertake it. I think that for us personally here, we feel that that's the way that we want to push it forward, getting the mosque involved, but making sure that younger members of the family are getting this older generation of particularly Asian members of the family to undertake it. There's a lot of mistrust, what we found locally in Redditch. I don't know if that's elsewhere, but that's what we've seen.
Well, I think the national picture reflect that too, Lee. Something that I know working with our Commons colleagues around trying to address that, and I know that Ramadan I think happens soon as well, so around the second dose. So we're working on that too.
Okay.
Alan.
Joanne. Oh, sorry.
Yeah, so Alan, you've got a. Sorry, James, I'll come back to you. Alan, you've got a question.
Thank you. Continuing with the BAME discussion in relation to vaccination, John raised it and Lee's raised it and so forth. My memory of what was decided nationally back last summer, when there was a question about whether people from the BAME community should be made a priority group. Yeah. My recollection is that there was a policy decision not to make the BAME community a priority group for receiving vaccination, but to take a special initiative through public health in relation to reaching out to the BAME community and encouraging take-up of and so forth. And that was supposed to be an extra initiative.
Yeah, that's what we did.
Yeah.
You're right.
What have we done? Has that happened?
Yeah, so you're right. The priority was put to age and exposure. So the how old you are and how exposed you are to the virus as a worker. But in relation to what I said earlier about inequalities, we've got a specific group. We're just getting the data through to see if we can see any areas that we need to focus on, pay attention to. But there is a public health and NHS specific group paying attention to that. And as the data comes forward, we can make sure we make an assertive effort around those areas that if we see it's not been taken up as much as we like. But equally, our commons are looking at the way we can make it cultural specific as well, and to do more action around
that. Simon.
Yeah, just to comment on that, Joe. We attended a meeting that, just for Alan's information, we attended a meeting that there was a Polish community representative at, and one of the mosque imams attended. So that work is we can vouch for that work is actually going on.
Yeah, there's a lot of work going with the church and spiritual leaders.
Yeah, it's quite a lot of work going on there, Alan.
Yeah.
Okay.
Joe, I just wanted to say before you finish the item, I just wanted to say something.
I think James wanted to ask a question as well. Simon. Yeah.
Oh, thank you. Yeah, if that's okay. Joanne, thank you for going through that. What is 10% of Herefordshire and Worcestershire in terms of absolutes? That's more than 100,000, is it?
So James comes in with the crucial question of trying to hide from you because I'm not allowed. Thank you, James. So, right, this is a public meeting, so please, I didn't say this, but it's about 77,000. But hopefully you'll find out today because the data comes live. So let's hope it's just happened in the last half an hour.
And would you mind as well, just I think you mentioned it there, the proportion of over 80s and people in care homes in Herefordshire and Worcestershire. And I think it was rather quick for me, that bit you said about the Midlands being ahead of the rest of the country.
No, so the Hereford and Worcestershire is the leading one in the Midlands. So our system has, as proportion to our head of population, we have the highest proportion of those over 80s and those care homes who have had a vaccine. So we're leading the Midlands in that. And
what are those proportions? Sorry.
So in relation to care homes, it's what we're doing. So interesting, it's gone down this week, so we're not quite sure how it goes up and goes down. But we were about 82% for care homes, and for over. So I'm just looking at my notes to make some notes this morning. I mean, it's 75% for over 80s. Now, the target expectation, we planned for 75% of over 80s to take it up. We think we're probably going to have more than that, actually. So we've reached what we planned for because we weren't sure how people would take it up. But 75% over 80s. So this data will be out of date by Saturday because we're doing thousands each day now. So just give you a sense of what it was on Tuesday.
Thank you.
Thank you.
Simon, did you have something you wanted to add? Because your hand's still up.
No, I just wanted to say something at the end of the item, if I could, before Joe leaves.
Yeah, and Alan, have you? No, hand was the legacy hand. I think that has anybody else got any questions for Joe? Thank you very much, Joe, and wish you well with your new role. And Simon.
I just wanted to say, Joe, just a personal thanks from me. I mean, when you first arrived, you arrived as a director at NHS England.
Yeah.
And I think when you arrived, it was, somebody who was prepared to be transparent and honest about stuff was really refreshing. And, you've been a great colleague to work with. So thank you for that and wish you well in the future.
Thank you. It's been a pleasure working with you for Healthwatch and yourselves too, and Peter too. So it's been really good, and I'll always carry on when I go to my next Health Watch and be as hopefully open and as transparent with them.
Yeah, we'll tell them to make contact with you.
I think they're on my interview panel, so I think they've clocked me already.
Thanks very much, Joe.
Okay, thank you ever so much, everyone.
Thank you.
Thanks.
Bye,
Bye.
Joe.
Thank
Bye.
you.